The First Nations Health Authority has grown so much in the last 10 years since we began operations. We started out with baby steps and cautiously moving our way along, and with great enthusiasm from the organization, and the community supported us because it was built by the community. It was fulfilling a need that they saw to have health equity within their communities. And so they were there and willing to participate and help us, not help us along, but tell us and provide direction to us as to where we should be going with our health.
Yes, I would say that it's important to reflect on some of the development of people over the past 10 years as well. And I would say that as we do that reflection, it's important to think about how FNHA, as part of its function, is really developing people. As we go forward, we need to continue to think about ways to bring people into the health field generally, but also to FNHA specifically. And I would say to that end, I'm very proud of our efforts to hire First Nations and Indigenous students, to introduce them to the work, provide practical examples, and to then look at ways to bring them ultimately into our organization or into other health service organizations across the province.
I think the FNHA has done a lot of great work. They bring services to us. The FNHA has such great staff.
And over the last 10 years working with FNHA in Sumas, you've seen a real marriage with different services that have been provided, whether it was counseling, doctors, nurse practitioners, eye doctors that come into the community. It has really brought in that much more services in community compared to when we used to have to seek services outside of our community.
Over the past 10 years, the First Nations Health Authority has made a difference in our community, mainly with regards to the relationship with the funders that are out there. Previously with Health Canada, it was a very difficult relationship, to say the least. And now we're seeing a lot more flexibility, understanding, compassion, cultural appropriateness, in the approaches that the First Nations Health Authority offers to our nation. So I would suggest that would be one of the biggest changes over the last 10 years that we've seen initiated through FNHA.
Some of the differences that I've seen in the last 10 years in our community is definitely health benefits have improved greatly for Indigenous people in the province. I see many more programs and services available to Indigenous people, and a broader awareness to the systemic racism that exists in the healthcare system, and allies wanting to assist in making a difference for Indigenous people.
But what I've noticed over the last number of years, especially with our Interior Region team and FNHA in general, is that we've been able to have conversations about our own ways, our own ways of being and how we want to do things, and transforming and changing, health services for our people. So I think that there's been impact. There is, of course, a lot more to do, and there always will be, as we've never been in this place in our history as Scale of people. We've never been here. And so we're kind of learning and growing and, trying things out as we go. And so I feel like with First Nations Health Authority, we have a concerted effort, a really specific effort to say, what does health mean to us? How do we want to do things in our own communities with our own people in our own ways?
The change that I see is that it's community-driven, community design on the programs, and it really helps our people because healing is so important. We have the programs designed by our own people, and it really is successful with our community because it's land-based healing.
Since FNHA came into existence, a lot has changed. We've gotten more autonomous in how we design and deliver programs to our communities in response to what they need and what the community is asking for, what the health needs are, and we're really able to design our service plans around our community.
I think the biggest impacts is that we see a lot of services come into the First Nations. We're always current with vaccines, and that was quite evident during the pandemic, that a lot of our people had access to the latest vaccines, and we certainly receive notifications when there's new vaccines that are going to be available to our members, and they certainly can take advantage of those when they're brought right directly to our community of Kitsilus.
I think over the last 10 years, FNHA has been very beneficial to our community. I think for so long, many individuals struggled as to know where they can go to access supports and services, and I think having those connections at FNHA and those supports and resources available have made a huge difference in the community members' lives, but also my family's life as well.
FNHA has been able to support increased autonomy for the nations. We've been able to increase capacity for health professionals, and as well our programming to support community.